Bianca Gallant says she went to the George Dumont Hospital emergency department with extreme abdominal pain on November 18th. She says she waited 14 hours, then started vomiting and having trouble breathing. A doctor brought her into another room outside of the emergency department, where she waited another hour to get an MRI.
My fiance told me I was in the MRI room maybe 5 minutes. They rushed me back to Emerge and told him that I needed emergency surgery right away, that I had an abnormal amount of blood in my abdomen. They ended up pumping out 2.5 liters and they weren't able to get it all. They removed my right ovary and my fallopian tubes.
She says the experience was traumatizing and still doesn't know what caused the internal bleeding.
I ended up needing 4 units of blood transfusion the following day. The surgeon came and seen us the next day and told my fiance and I that I was minutes away from death and I was lucky to be alive. And he encouraged me to put in a complaint about it.
While Vitalité said they could not comment on the specific incident, their senior vice president of clinical programs and medical affairs said in a statement, "There was no shortage of nursing or physician staff that could affect the emergency department at the George L. Dumont University Hospital Centre. There were also beds available for patients who might have required the type of care described by the patient." Gallant is calling for systemic changes so doctors and nurses have more support and can better care for patients.
It was very eye-opening. I would have never imagined it was as bad as it was if this would have never happened to me.
She is planning a rally in front of City Hall this weekend. She's hoping for support from Moncton's Muslim community after they held a rally last Saturday after one of their own passed away in the emergency room of the Moncton Hospital. Suzanne Lapointe, Global News, Moncton.